You are now entering a dangerous liberty zone where God-given natural rights are held sacred and exercised. This is your warning. Tyranny, fascism, and censorship will not be tolerated. Ideas will be exchanged freely. Rigorous debate and open discourse is encouraged. If you are weak and your beliefs are fragile, you should leave now. Prepare yourself. We are now live on the Dangerous Liberty Podcast. Happy Wednesday, everybody. Everybody, welcome to the Dangerous Liberty Podcast. Where we know the only thing more dangerous than liberty is the lack thereof. All right, we got a very special guest on tonight, and I think it's a very important topic that we're going to discuss today, and it's going to be a lot of fun. But I want to go ahead and welcome everybody. Jason Sponsler, Iron Stomach, welcome. I don't think I've seen you before, buddy. Welcome. William Gittins, greetings from West Virginia to Georgia. Willie Everett, good to see you. Mike Hinn, Andre D'Angelo, Lloyd Castleton, Holy, Jason Sponsor, Callan Gallagher, welcome. And everybody else that is tuning in right now, as well as those of you that are going to be tuning in the future. Jackson, I think my headphone number is 3. Will you turn that down just a tad for me? Thank you very much. I can't stand the sound of my own voice. Now I know how my wife feels. All right. So hope everybody's had a great week. We are running a skeleton crew, and by skeleton crew, I mean me. Chris is out sick. Jason had some baby issues. Summer's having some technical issues that she's dealing with over there. And I got Jackson back there being my producer tonight. There he is, Chris. Chris feigned sick, so he said he couldn't make it tonight. But, whatever, Chris. I see how it is. Jeff, good to see you. All right, we are going to jump right into it. Tonight we're going to be talking about subconcussion, and I'm going to have Dani come on here and introduce herself, talk about her work. She has a presentation she's going to give us. Folks, I think this is, number one, it's an issue that hasn't really been recognized until recently. And honestly, where we first started hearing about this, they started identifying these things was through football. And we're seeing now that our war fighters are experiencing some of the same things. And, one of the articles I saw probably about a year ago was the first time I saw this, was talking about, I think they were talking about breacher syndrome. And I'll let Dani talk a little bit more about all that stuff. Well, you know what? Let's go ahead and bring her on. I'm going to have her introduce herself, and then we will jump right into this. So Dani, welcome.
Welcome.
Hi, thanks for having me.
I'm glad you. Yeah, just if you will, just go ahead and introduce yourself a little bit. I'm getting some echo. Folks. We started this whole thing off with a lot of technical difficulties. And I am going to give you the floor, Dani, and mute this in case everybody else is hearing but I am.
All right, sounds good. My name's Dani Fennerty. I have my doctorate in physical therapy, and I come from a background in vestibular rehab, but also having had experience working at JBLM and just getting to work with a lot of veterans, even 100-year-old World War II veterans. So I've gotten to work both with elite operators and operators later in life. So I'm not sure if, Gary, you want me to go ahead and start with the presentation. I can try to pull up my presentation now, or if you had anything else you wanted to touch on before I got started.
No, I think that's it. I think I'm getting up there, so probably the less I the better. So if you want to jump into the presentation, that'd be great.
Yeah. Okay, so let me go ahead. See if we can pull this up.
And folks, I'm going to go ahead and add her to the stage. Again, we jumped on here. We got out here at 6:30, and we were basically just having technical issues from the beginning. It's just one of those things that happens with when you're doing one of these remote things. So we're going to jump in here, and I'm going to give her the stage. She can go ahead and present. I'm going to add that, and I'm going to make this just like that. So, Danny, I'm going to unmute your mic and take it away.
Okay, so let me go ahead and make this full screen. Is this showing up for everybody?
Yeah, you're good to go.
Good to go. Okay, awesome. So it looks like I'm going to get started here. So really for me, this all started a few years ago when I was working as a physical therapist, a civilian physical therapist on JBLM. And during that time, I had a 37-year-old male special operator who had been referred to me describing this intangible feeling of slowing down, particularly while he was in more visually stimulating environments. And he didn't have a specific injury, no what we would call clinical symptoms, and he was still performing at a high level. In fact, he was still deploying. But he just knew he wasn't performing at a level that he knew he was capable of. And, this experience with this operator really unnerved me because, we're all trying to ensure that you have every single nanosecond of an edge possible. And I certainly didn't think it was acceptable to have any kind of feeling of slowing down. And I also knew that he was likely just the tip of the iceberg and, that many other people were likely experiencing this as well. So I really kind of wanted to answer a few questions after that experience, which was why was he experiencing this intangible slowing down over his career? And I also wanted to look at how can we go beyond quote unquote normal and really offer strategies to train performance, particularly of the sensory systems for situational awareness at the highest possible level. Because I think we all can recognize that there's a huge difference between being cleared for duty versus ready to perform at the highest level. So I really became a little bit obsessed and truly did a deep dive into the research, and it took me some time to really put some of the things together. And, one of the reasons was because there's just such a significant lack of research on subconcussions, particularly subconcussive blast exposures. And it was actually stumbling upon some studies in the MMA world that really kind of fit things together for me. And kind of progressed from there. And I think that this study in particular really highlights that lack of research that we have even now. It was a literature review of high quality studies on blast exposures from 2000 to 2019. And what they found was that out of 3,215 studies, only 43 were on these repetitive low-level blasts. So that's only 1.34% of the research on blasts dedicated to these subconcussive blast exposures in a 20-year period. And that's obviously a significant 20-year period for blast exposures as well. So I wouldn't say it's not a lack of an issue. It's definitely a lack of our understanding of the issue and researching the issue itself.
Danny, I'm going to throw you on mute just for a second. On that, so have they done any studies as to figure out, what type of blast or how much is it, from an AT4? Are they getting subconcussive injuries from things like, just launching mortars? Have they quantified what it takes to actually get these types of injuries or anything like that?
They have studied a few different weapon systems, and I have them listed out in a little bit, and we'll if we can dive into those a little bit more. I think it's this next slide, actually. Yeah, so cited in this studies most often. So I know that you're the weapons expert, certainly not me. And I think that you could speak to how complicated this truly is because of the physics of blast waves. And so obviously there are a lot of different variables involved, not just a specific weapon system, but the environment that you're firing that weapon in, and your position relative to, that low level blast exposure as well. Is that right, Gary?
That's exactly right. I just remember one day that when I was deployed with my team in Iraq, we were actually on it was actually an Iraqi military base, but it was Camp Caldwell that was nearby us, FOB Caldwell, and they had like 3 connexes of AT4s they didn't know what to do with, so they ended up giving them to our team. We went over there and happily picked those up, and I know I personally shot 29 that day. I don't know if that's good or not.
Probably not. Yeah. It's definitely a challenge because obviously sometimes like the job requires what the job requires, right? So there's really this dichotomy here where, you have to do what you have to do to get the job done and be prepared, but it's also, it affects both performance and obviously has a potential impacts on long-term quality of life.
No, that's 100% right. And the thing too is when you when you're young, you're obviously you're a lot more willing to take these risks, and you really don't understand the long-term effects that well, I'll say this. You know that there's likely going to be some long-term effects, but you don't really understand how severe those could be or how much they affect your quality of life. And of course, being young and dumb and in the middle of a war, you're not thinking beyond redeployment, to be honest with you.
Sure. Yeah. Yeah, certainly, it's a complicated issue, and I don't think there's really going to be, one single perfect answer to it. There's hopefully going to be a lot of different strategies addressing a holistic approach and a lot of different experts providing a whole lot of different options for people. I think that's going to be an important piece of this, for sure.
No, I think you're right. And I think that it sounds from, just the conversations that I've had and just watching some of your work on Instagram is, by the way, folks, down in the link of the description, down in the description, there's some links with some of the information that she has, her website. And this is something we're definitely going to have her on again, if nothing else, just to remedy some of these technical issues that we're having tonight. But I want to kind of stay in touch with this and make sure that we're staying abreast of this and making sure that we're that our military is being protected and these issues are being addressed in the future and being taken seriously by those that are still in the military as well as the VA. This is one of those, just another one of those issues that we're going to see where people are going to start displaying different symptoms and issues with this, and it's probably not going to be taken seriously right off the bat. That's just usually how these things work. But I'm going to give you your mic back, Danny.
Oh yeah, interrupt me anytime, please. Yeah, there's definitely a lot of advocacy that needs to be done, and the only way we can do that is for people with, the most skin in the game, telling us what you need, what you're experiencing, and talking about this. And I know that while on active duty, it can be kind of challenging to be able to speak up and, describe these symptoms, especially to people that may not have these expertise and perspective. I certainly know that a lot of people, even in the medical field, are not familiar with this at all. And so hopefully we can all kind of make an impact on that. So I'm just going to back up just a little bit. So we're talking about, and as Gary, pointed out, this is an extremely challenging issue to address because of how subconcussions are defined. And it's really a head impact that doesn't result in clinical symptoms. So they're below the threshold to cause or elicit any kind of sign of a concussion. So as we talked about, it's not that one exposure, but the repeated exposures. And likely it's, a lot of different variables contributing to that. It's not going to be like, okay, if you fire that sniper rifle 1,000 times, then you're going to have issues. There's just going to be so many different variables involved with this. So certainly low-level blasts are of a huge concern. And I'm sure Gary and you all can add a whole lot of different examples to what might constitute a low-level blast exposure. There's also other kinds of subconcussive exposures that individuals in the military are exposed to as well. So I think it's important that we recognize the holistic perspective and we don't just ignore other potential exposures and solely focus on the low-level blasts. So of course, from sport research, we know the impact of direct hits to the head, right? So like in any kind of boxing situation, hitting soccer balls, football, we're knowing a lot more about direct hits as a mechanism of subconcussive injuries. And then we also have coup contra coup exposures. So that's kind of demonstrated in this bottom left picture here. So like a body slam in combatives, hard landings when airborne, falling off a striker, whatever it might be, that you're not necessarily directly hitting your head, but your brain is getting shooken up inside of your skull because our brain is suspended inside the skull within fluid. So I like to picture it kind of like a fish riding in a fishbowl inside your car on the way home and you slam on the brakes. Well, that fishbowl can remain intact and not have anything hit it, but that fish will have slammed forward and back inside of that fishbowl, like your brain can slam forward and back inside of your skull. And then finally, I incorporate oxygen deprivation. This is common in training for people with extreme underwater breath holding situations, as well as like getting choked out in combatives. So I think it's really important that we are recognizing, again, all these potential exposures because it certainly can impact strategies for addressing this as well. And pertaining specifically to the underwater breath holding or oxygen deprivation, it's not really discussed either in the media or the literature. And the reason I incorporate it in here is because of this one study I came across from a Swedish breath hold diving competition. And what they found was that the divers in that competition, after the competition, had increased what we call biomarkers for traumatic brain injury after that. And so we're going to dive into the biomarkers and the significance of our understanding of this in just a little bit.
Awesome. And folks, real quick, what I want to say too is, again, we're going to kind of let her go through this presentation. If I'm already highlighting some of your comments and we're going to bring those up at the end. But if you want to save some of your comments for the end and ask her questions or anything like that, we definitely want you to do that there toward the end. Anyways, let her get through this presentation and I'll probably stop her and talk to her because, I can and you guys can't, but that's just how that works. But anyways, go ahead, Dani.
Okay. So the big struggle is to be able to detect these subtle changes, in real time, right, in active duty individuals. So one of the ways that researchers are able to do this is through something called functional connectivity. And this is really where they measure changes in how the brain communicates. And this was a really good study done on Canadian Special Operations Forces, or CANSOF, and they included breachers and snipers who had an average of around 10 years of exposure to these repeated head traumas and compared them to controls, so to individuals without these kinds of low-level blast exposures. And they found significant differences in the way the brain communicates, particularly in regions responsible for visual stimuli processing, working memory, spatial processing, and attention. So there was this other study that was looking on how the brain's communications are changing with these exposures, and this was one done on U.S., Iraq, and Afghanistan veterans. And they found that those with close range, which they defined as less than 10 meters of blast exposures, they had changes to the resting state brain activity, even without any concussion symptoms at the time. And so resting state brain activity just means that they're just sitting there. They're not doing like a cognitive task or a motor task as they're imaging their brain. And they found that they had significant changes in the way the brain regions that are responsible for the function of the somatosensory system, which we'll dive into later, and motor control. So kind of ownership of movement, ability to move with speed and precision in just about any environment. That's what they're showing. The regions of the brain are being impacted. Like I mentioned with the Swedish breath hold diving competitors and how they had these traumatic brain injury biomarkers, that's another way that researchers are able to determine these subtle impacts of these exposures. So they're looking at neuroinflammatory or neurotrauma biomarkers. And they found that, I believe this is out of Walter Reed, and they studied active duty U.S. Army and law enforcement personnel who were exposed to repeated low-level blasts. And they included breachers and snipers, as well as hand grenade throwing instructors. And I really want to emphasize this participants of this study were healthy, high-performing, cleared for duty individuals. And in the active duty individuals, the levels of these proteins that are related to traumatic brain injury were associated with duration of service. So the longer an individual had served, the higher the levels of these proteins that are related to traumatic brain injury. So really what they're measuring is they're having these more neurotrauma proteins in their blood serums. And I think it's really significant to note that serum levels of something called amyloid beta 40 and 42, which you don't really need to worry about that specifically, but these ones were at least 50 times higher among the study participants than controls. Like 50 times higher is very significant, and I think it really highlights, the urgency of us addressing this, particularly because these amyloid beta peptides have been associated with increased risk of Alzheimer's disease.
Now, Dani, on that, are they actually able almost in real time to test for these different changes in the blood? And can they diagnose that kind of on the spot? I'm wondering if there's going to end up being, hopefully there are, to where there's protocols where, again, you are constantly getting your head bumped and different things are going on in the military, especially in special operations. You're constantly being exposed to explosions and things like that. When we're talking about these blood tests that identify these different markers that are obviously identifying, some sort of brain injury or damage to those neurons, how fast is that and how fast can you get the results from that?
My understanding is that it takes some time because they can draw the blood immediately, but then they have to send it to a lab to be evaluated. However, I have seen some research that they're looking at essentially like a breathalyzer type technology where you breathe into this breathalyzer and it will be able to tell biomarkers that are significant for brain trauma. So that could potentially be, a technology that we hopefully see in the future that can help guide, people at the range to be able to decide, hey, this is too much, kind of a thing.
No, that makes sense. I remember it was like, I don't know, probably halfway through, probably, like 2005, 2006, after I'd already been in the military a long time, was the first time that I ever had a blood test for lead. And I know they're starting to monitor that type of stuff a little bit more. They're also, when I was deploying to Afghanistan in 2009 or 10, was the first time that we had ever done a pre-deployment cognitive test. And of course, we had to take another one when we got done. So, I mean, obviously they are making some changes and they're making some advancements for this. I'm just always curious to see how much of this is kind of, them hedging their bets and just kind of, turn it into a finger drill, or if they actually plan on taking this stuff seriously. And I guess on this, we'll have to wait a couple of years to see what they're doing and how proactive they are with it.
Yeah, they're certainly, prioritizing this, especially from a research standpoint. One of the things, though, that I do definitely want to dive into here is that, just because we don't have all the information and all the perfect solutions, it doesn't mean that we can't take action now to promote brain health and take care of ourselves and each other, right? So, there's always that kind of a thing where research is never ending, and it never should be ending. We should always strive for a better understanding, but we can always take action based on the information we do have, and that will always continue to evolve and update as we get more information.
Yeah, I'm curious what your thoughts are as far as, I see what you're saying as far as the research that people are taking this from more serious from a research standpoint, do you feel like that the military is starting to take it seriously as well?
You know what? I can't speak to that, because I'm not in the military. I think that it's because it's such a big organization too. I think there certainly are individuals that will take it more seriously than others. One of the things that I really try to highlight, even with this presentation, is how this has immediate impact on our force's readiness and lethality, and how this isn't just a long-term thing. This is an immediate urgency. And my hope really is if we start to look at it from a performance perspective and a readiness and lethality perspective, we might get some more buy-in from people that aren't necessarily are needing to prioritize long-term health for people because they're worried about winning wars, right?
No, that makes sense. I mean, at the end of the day, with every sort of emerging health issue amongst veterans, it's always been the civilian sector that essentially has had to, force the government's hand. So, that's why I think your work and everybody else that's working on this in so many different areas, whether we're talking about the physical ramifications of this or even the mental health ramifications of this, are very, very important. And I think there's so much that overlaps. And I know when we get into the mental health portion of that, that's not your area of expertise. But at the same time, I do think that, there is, just from the research that I've seen, there's a lot of overlap between those two. That's really what it comes down to.
Absolutely. It's all just a piece of the performance puzzle. Everything, if you have an injury, that's going to impact your mental health. If you have, some mental health problems, that's going to impact your physical performance. So, we always have to look at every variable, and I'm going to be biased towards the motor component, but it certainly doesn't mean that I don't value the mental health or cognitive side. It's just I'm not the best person to guide people through that kind of those kinds of issues.
Sure. Yep.
Okay. So here you can see certainly a lot more studies need to be done with regard to risk factors and variables impacting the long-term health here. But these are just some studies and certainly some things that are of issue. Obviously, a lot of people talking about CTE, Alzheimer's, dementia. I don't know if you guys have heard that there's an increased risk of young onset Parkinson's disease. That was a study done out of a sports medicine, though, and then, of course, later life depression, significant impacts on mental health. And the big takeaways I really want to emphasize here is that the functional connectivity and biomarker research, they're sensitive enough to detect these subtle impacts that subconcussions can have on the brain, even in asymptomatic, high-performing individuals. So that's, some good news there. And then, the functional connectivity changes. So the changes in the brain communication are in regions consistent with common symptoms, like areas responsible for emotional control, memory, and motor control. And so what I like to emphasize here is it's quite literally a change in what I think of as the roadways of the brain. And so if we know what roadways are vulnerable, we can always try to proactively and progressively, continuously build up those roadways as much as we possibly can. And like I mentioned, I certainly care about the long-term impacts of this. And, I work a lot with people with progressive neurodegenerative diseases. But I also want to emphasize that it's not just long-term health. It has an impact immediately on readiness and lethality, which really means it has an impact on the ability for our operators to get the job done and come back home. And so it's something that we really want to address, hopefully in a proactive sense. And this is a study that was done on operators in elite military units serving between 10 to 15 years who had these repeated low-level blast exposures. And they showed impaired speed and accuracy with divided focus and target following eye movements compared to controls who didn't have these repeated low-level blast exposures. So to really, emphasize what's happening here, these are operators who are sitting in a quiet room, looking at a computer in a low-stress environment, and they have impaired target following and divided focus, speed, and accuracy. So that's going to have significant impacts on how they are able to perform, particularly if we're starting to add in movement, highly sensory stimulating environment, and load up cognitive and emotional stressors on top of that. So, we obviously want to be, preparing everyone to be able to have a high level of a baseline to prepare for those kinds of scenarios and not have impaired baselines like the research is showing is coming up with these individuals. So to pull back a little bit here, these are the 4 primary sensory systems for situational awareness. We've got your visual, auditory, vestibular, and somatosensory systems. And the reason we care about these systems so much is because these sensory systems sense information regarding your body and the environment, and they send information to your brain for processing. And your brain processes that information and commands an output. So that output could affect cognitive, emotional, or motor responses. And so when we have impaired processing, it can really paralyze our output capabilities. You can be the sharpest shooter, you can be the fastest and the strongest on earth, but if your processing is impaired, the input and processing component are impaired, it can paralyze that output. You won't even get the chance to create that output, right? So I think it just really emphasizes how when we talk about performance and readiness, it's not just output capabilities, it's the input, processing, and output to really be performing at your highest possible level. So I like to look at processing speed as a simplified equation of just the change in the inputs over the change in time. And so what really that really means is that the more changes in your sensory inputs over a shorter period of time, the higher the demand on processing speed of your brain. And obviously for our warfighters, processing speed is vital, and they're really the individuals that have the greatest demand on it, even compared to any other Olympic or professional athlete.
Danny, I'm going to throw up this question right here. I know, I think the reality is that a lot of times, and a lot of times a lot of times people are looking for, well, how do we fix this? And hopefully we continue to develop different drugs and different treatments to where we can not only diagnose these issues, but obviously treat them and hopefully, counteract them and repair those issues. But I think a lot of times it doesn't seem to be the case in that, ultimately, what are you seeing as far as how effective, number one, are their treatments, both from a physical therapy standpoint, as far as neurological repair treatments or anything that's going to slow damage? I know some of those drugs are emerging now, these anti-Alzheimer's drugs, things like that. But what is the state of medicine when it comes to those types of things?
Yeah, here, let's go to this next slide here. So really when we're talking about addressing this, there's going to be 2 kind of variables that we break it down into. Variables that really raise your ceiling of potential, and then variables that pair training to perform at that, right? So if I take steroids, I can raise my ceiling of potential, but I still have to do the work and lift some heavy weights and train to actually be at that. And so really what we can do is come up with strategies to raise the ceiling and also incorporate training strategies to be performing at that ceiling. So for raising our ceiling of potential, there's obviously acknowledging and knowing the 4 potential mechanisms and trying to mitigate exposures wherever possible. And then I think that a lot of the research, particularly the biomarker research, is going to give us a lot of guidance as to how we can optimize time between these exposures. So we know that we're giving the brain, the body, time to clean all these neurotoxins out of the brain. And then there's, of course, optimizing sleep quality and sleep prioritization. So I really advocate, if you know that you're going to be exposed to these low-level blasts, that's not the time to stay up all night or go out and have, drinking or anything like that. You really want to prioritize sleep after those exposures. And one of the reasons being is that during sleep, there's a system called your glymphatic system that's most active. And what the glymphatic system does is it flushes neurotoxins out of your brain. So that's a strategy too to, your body is pretty incredible with how it can help itself, and you just want to set yourself up in variables that you can control and are within your control to optimize those as much as you can. A lot more research is going into nutrition. Obviously, hydration has some impacts on this. And then, of course, the pharmacological interventions. For the medication, it depends on what you're really speaking to. Are you speaking to, later in life, kind of Parkinson's and medications for CTE and Alzheimer's?
Really all the above. I mean, are there treatments that can be, is there a pharmacological answer when it comes to immediate treatment? Is there, I know as we get into Alzheimer's and some of these other things, other cognitive issues, they're coming up with additional and better treatments for those. There always seems to be, there's always talk about something on the horizon. Currently, when it comes to what is available, what is out there for treating these types of problems, whether they be the near term or the long term?
I haven't come across any pharmacological interventions for near term. I think it would be it's going to be a very challenging and interesting. I'll be interested to see the community's response to these options, because when we're talking about prolonged repeated exposures, how many are you taking medication or injections after every time you're in the field or at the range? How much is too much? What are what we call iatrogenics of the medications? So that would be the potential harm that they could cause as well. So I'm not familiar with that existing. Hopefully options like that come up, but those are also some considerations to have as they come up too. And with regard to like Parkinson's and Alzheimer's, I haven't seen anything with regard to CTE, but that doesn't mean medications don't exist. But it's hard with CTE because it can only be definitively diagnosed after death or post-mortem. There are a bunch of different medications. A neurologist is the best person to ask about that. But, I think it's important to recognize, and as someone in my role as a physical therapist who works with individuals with like ALS, Parkinson's, dementia very frequently, it's not just the medication, but the importance of, training to optimize these different areas that are vulnerable to these impacts, to really get the most out of your body and yourself. So there's no magic pill, and there's always going to be needing to have some targeted training involved in it.
So, as of right now, there's nothing that they're administering prophylactically to combat some of these, or when they identify some of these injuries as of now.
Not that I'm aware of. Has anyone in the audience, any of you heard of anything that's being...
These guys are all knuckle draggers. They don't know.
Okay. Yeah, I mean, certainly if anyone hears of anything, I'd love to, let me know about it. But I haven't heard of anything. And it's always hard because it's, if it exists, do you have access to it? And if you have access to it, especially in the US at least, is it actually affordable treatment too? So those are all of these considerations as well when it comes to the pharmacological advances.
Yeah, and I think, obviously this is starting to come up in the last 5 or so years, but I do think that we're definitely behind the power curve when it comes to the overall research. So there may be obviously some things that are in the works. Who knows how effective those are? But I do think it's early, and that's why I think it's just so important to get you on here and to do the little that we can to spread this message and make people more aware of this. And again, most of the folks that are in the comments right now are veterans. We've seen all these things, and like you said, CTE is only diagnosed after you're dead, and then they dissect your brain. But I think it's something that we need to be more aware of for sure. And like you said, on the military, on the mitigation side, and you can do whatever you want from a big army or big DoD standpoint, but I think it's really important to educate the operators on the ground because, sure, I always heard it's not a good idea to shoot more than like 2 AT4s or take so many blasts in a day, but at the same time, nobody said, well, this is why, and educated us so that we're being more proactive on the mitigation side at a personal level, as opposed to, these are just some rules that are being imposed on us because, they don't know what they're talking about, or they don't know why, or whatever it is.
Yeah, and I consider, that's like the dichotomy of this, right? And I think especially with some of the younger operators that understanding that it can impact their performance and their reaction times and things like that, I think can have some more buy-in than them us talking necessarily like, well, you might get dementia kind of a thing later in life. But maybe not. I think it's important to know, obviously, the whole picture. But I think that sometimes if we speak more to the immediate performance side of things, we might get, especially some of the younger guys, buying into this and taking it a little bit more seriously as well. I don't know your thoughts on
No,
that.
I think that's 100% correct. I think that if you let them know that, hey, that this can affect you on the immediate, those are going to have the biggest impacts from a team level SOP on some of these issues, and the team itself looking out for one another and saying, hey, you know what, this can literally make us less functional as a unit. It can make us less mission ready, and that is a huge buy-in because, like you said, especially when you're overseas and you're in the middle of conflict and you're going out and doing hits and raids every day, like you are not thinking much, 20 years down the line, much less, or even 5 months down the line. You're getting through that one mission. I'm gonna do whatever it takes to get through this one mission. And the training is the same way. Training ends up mimicking that. You're like, hey, I'm bulletproof, there's nothing that's going to happen to me. We're very short-sighted on that end, and we're very mission focused, and that's why on the soft side we are so impactful in what we do. But at the same time, it is something I think that we all need to be more aware of. And I know even from like the functional fitness side of that, we've gotten a lot better over the last 20 years. We're training smarter, not harder necessarily, and just taking a much more strategic approach to health and wellness overall.
Yeah, no, that's great. And it's great to see how, all the different disciplines being involved because everyone has an important role that impacts, the holistic performance picture. So the next part that I want to really touch on is that we're wanting to raise the ceiling of potential, but we also need to train to be performing at that ceiling. And so really I think of this as like, all right, we got to really target the vulnerabilities. And so from the research, we know regions of the brain that appear most vulnerable to these repeated subconcussive exposures. So these are the regions responsible for emotion, memory, motor control. And we also know that the performance of your sensory systems for situational awareness are vulnerable to these impacts, right? Because the brain's processing that information and it affects all three of those categories as well. So the big strategy here is if we can identify variables that are within our control to keep that ceiling as high as possible until they do come out with, some kind of a pharmacological treatment for this, right? Then we want to make sure that we're training to be capable of performing at that ceiling. And so really what this boils down to is something called neuroplasticity, in that your brain is under constant construction, but it just needs to know what roadways it wants you to build up. And so if we know specific roadways that are vulnerable to these exposures and we can't mitigate them all, then we need to make sure that we're proactively and continuously training up those roadways that are important to us and have those vulnerabilities. Because in the research, how I talked about that functional connectivity, those changes in the brain communication, well, they have research in people with strokes, Parkinson's disease, even early dementia, multiple sclerosis, where even with training, we can change even in these horrible neurodegenerative diseases. There's still hope to change and create new pathways. And so what I really want to emphasize here is that there is still some hope to really build up these important roadways as much as we can. And so that's really working with experts in these different areas and what I think should be a proactive and continuous training approach. And it just, I think it's important for all of us, obviously, to do that throughout our lives. But if you have these exposures, it really just emphasizes the importance and urgency in doing so. So I'm obviously not an expert in emotional control or even cognition, but I can help with motor control, in which I really see as ownership of your movement. And so this is where I think I can really hopefully get some more buy-in into some of the younger individuals that are wanting to keep pushing the ceiling of potential, wanting to keep having that edge. I mean, obviously everyone does at any age, but maybe a little bit more buy-in from them, as they're not as worried about the longer term scenarios quite yet. And so really how I see ownership of movement is controlling your movement under any condition. And ownership of movement's truly dependent on your visual, vestibular, and somatosensory systems. And so when we talk about being prepared for different conditions are going to bias the demands on the different systems. And so really what we want to do is ensure that we have all three of these systems working and being processed at the highest possible level. So we really train to proactively and continuously train and target these capabilities. So you probably are familiar with your visual system, but you might not know the somatosensory vestibular system. So your somatosensory system is responsible for sending information regarding temperature, pressure, pain, and what's called proprioception. And proprioception is what's going to signal information regarding your joint, tendon, muscle position, right? So as I'm sitting here, my knees are bent at a 90-degree angle. I don't have to look down at my knees to know exactly where I'm at. And that really translates into, like this picture here, being able to maintain your balance, speed and precision of your movement as you're walking in different conditions, wearing snowshoes, carrying a heavy ruck, awkward loads, things like that. And it's just the quickness of this system also helps to decrease the load on your visual system. So instead of having to stare at the ground and your feet to maintain control, you're able to use your visual system to acquire and engage targets. And then we have your vestibular system. So this is in your inner ear. It's just deeper to your hearing system. And its job is to sense linear and angular acceleration. And there are three important reflexes of this system that I want you to know about. The first is that it's going to a reflex that keeps a target in focus with acceleration. So if you want to have a target in focus while you're running, and when you run, you have these accelerations up and down, you need your vestibular system to be working and processed at a high level. So this gentleman here on the left on the boat, if he has that target and focus on land, but he's hitting those choppy sea and waves, it's going to be his vestibular system that enables him to keep that target in focus. And if it's not performing or being processed at a high level, then his vision will slip off the target and have to jump back on, losing precious milliseconds of ability to know where his target is and engage with it. It's also responsible for keeping your head position with that acceleration, as well as keeping trunk position with any kind of acceleration. So if you want to stay on the boat during those choppy seas, it's going to be the fast processing and signaling of the vestibular system that's going to allow you to do that. And to really drive this home, I like to use bull riders as an example. I don't think many bull riders realize that they're kind of experts in the vestibular system and have highly functioning vestibular processing, but they're a great example because, force is mass times acceleration. So anytime you're experiencing an external force, you're going to want your vestibular system functioning at a high level because it's going to sense that information and elicit that response that allows you to maintain your balance. So it's this bull rider's vestibular system in particular that's going to help him stay on that bull. Of course he's strong, of course he can endure a lot of pain and have this mental toughness, but you can have all of that, and if you don't have that vestibular system working at a high level, sensing the angle at which that bull is bucking, and if it starts to turn, that you're able to adjust and stay on, that's the vestibular system. It's also going to be important for maintaining your balance when you're kicking indoors. It's going to be important for keeping a target in focus when you're experiencing a weapon's recoil. All of that those acceleration, whether it's an external force or you generating a force, those acceleration, sensing that acceleration is going to be your vestibular system. So it's really, really important for performance. Unfortunately, with subconcussive exposures, many people become dependent on their visual system for control of their movement. So this was a study that showed that these repeated subconcussive exposures reweighted sensory processing to increase dependence on the visual system for postural control, meaning that these fast vestibular and somatosensory system information is being downgraded and we're increasing dependence on the visual system. And this is also extremely important to recognize that your vestibular system, the responses of the vestibular system are almost 5 times faster than the responses of your visual inputs. So that's like a 5 times faster of an edge of response time. So it's certainly something that we don't want to have too much of dependence on the visual system, particularly because operators are often working in low or no vision environments. And I typically see, in my experience at least, really one of two things that happen with increased visual dependence for motor control. Either someone loses the speed of how they're moving, or they're losing the precision of their movement. And obviously, neither of these are good options. So I've brought up a lot of problems, but I haven't really offered any kind of things of like what you can do now for training this. And so when I was thinking about this, there's obviously an infinite number of ways, just like strength and conditioning, there are an infinite number of ways to train. But for operators especially, I think the most important thing is that you can do this kind of training and build up these systems and how they're processed, build up these motor control roadways, and do so anytime, anywhere. And I also felt like it should have a systematic and progressive approach with no specialized equipment. I'm certainly not trying to add any more weight to your ruck, and wanting it to be able to really expand and have no ceiling when it comes to progression and how far an individual can take it, and building upon it with specificity. So it really boils down to speed and precision. So the main goal is to maintain speed and precision of how we move with increased visual, vestibular, and somatosensory demands. And movements themselves can be done with specificity, and they should be done with specificity. So, common movement patterns, especially in operators, are lateral shuffling or like an alternating lunge, having to do some kind of a lunging movement. And so we can have these baseline speed and precision of these functional movements and progressively load the sensory processing demands to really build up those brain roadways for those functional activities and elevate performance capabilities. So when I train this, I typically start with just a movement pattern like lateral shuffling with a single target focus. And the key goal with that is to keep eyes on target and target focus throughout that movement while we're maintaining speed and precision of the footwork. And this is really where we begin to train to decrease that dependence on the visual system for motor control. And it's really foundational to the ability to execute under highly visually demanding conditions, as well as those no to low vision conditions. And it's training something called smooth pursuit eye movements, which is really target following. And that's what we had talked about earlier as having reduced speed and accuracy in special operators with those repeated subconcussive exposures. So I think that just really emphasizes the importance of continuously and proactively training this skill.
Then it sounds like essentially people that are having some sort of cognitive decline due to these subconcussive injuries are almost losing proprioception. Where again, it's like to know where my hand is and where it's going to my phone. I'm having to visually look at this. When we talk about the physical therapy treatment of this, from that slide I kind of gathered, it sounds like, are we looking at training gross motor skills, or are we looking at more fine motor skills without looking, I guess, is kind of my question with that.
Well, when it comes to physical therapy, we always do, an evaluation and seeing where an individual's deficits are and target those specifically. And typically it'll include lots of balance and things like that, right? With these kinds of progressions, this is how I really look at it for training in a proactive performance type of a way, where it might not be something where someone is having lots of symptoms and needing to have a specialized physical therapy programming, but someone who knows they have these exposures, knows they have these vulnerabilities, and wants to target them in a proactive training way. And so the proprioception is one component of that. And yes, we want to build up that region of incapability. And so as we do so, we're, increasing those roadways, improving that roadway of that region of the brain that I showed in the from that study on US, Iraq, and Afghanistan veterans. Their somatosensory system is the communication of the somatosensory system has been impaired with those individuals. And so we want to make sure that instead of being reactive about this, I think we should be incorporating a proactive training approach. And this is just how I load that in a more performance type of way.
Yep, that makes perfect sense.
The company that I started, all of this really came from the belief that, physical therapy has its absolute place, and I want you all to come in to see a physical therapist if you need it. But I also recognize that, I want to give you a proactive and performance training, just like you would a proactive strength training, right? But for your sensory systems, because they're so important, and this capability is vulnerable to these repeated subconcussive exposures. But it's so subtle, and it might not be clinically relevant, but it's performance relevant. And that's really important, particularly like I said, being able to do the job and come home. So that's really where all of this is coming from.
Well, yeah, and I also think too, one of the problems that I see is, well, let's back up a little bit. So first of all, a lot of the people in the comments right now are veterans that, and some not, but still, obviously you can actually have these same types of injuries and experience the same type of decline, whether you're a civilian or veteran or not. You may be in some sort of, maybe you played football in college, maybe whatever it happens to be. But it sounds like this is one of the reasons that it's so important if you get out of the military or out of playing high level sports or whatever it is, that you continue to um number one, you continue to work out, you continue to train, you continue to develop those skills that you have, because and I see this time and time again. I'm not necessarily saying that it's necessarily related to subconcussive injuries, but you see guys get out of the military and then they do nothing, and they decline so rapidly from a mental health standpoint, from a physical standpoint. And that's the other part that I've always detested, the idea that we pretend that we're not a single human being. My physical abilities are absolutely intertwined with my mental health and everything in between. So I think this is another good reason why it's so important to maintain your skills regardless of what age you are. Get out there, make sure you're active, make sure you're training. And for those of you that are just civilians that just want to protect your family and your friends and yourself, that's why it's so important to continue to challenge yourself mentally, physically, and get out there and train. Get out there and train and make sure that you are the best that you can be on any given day. And I think that's really what it comes down to.
Yeah, it's all skills, right? And so we can look at it from the skill of like emotional fitness and cognitive fitness, motor control fitness, just like strength and conditioning, or how well you're doing shooting at the range. And it's something that, you're never one and done. You don't get to eat that perfect meal and then you never have to eat healthy again. And it's similar with, these different skills too. And I think that recognizing the importance of continuously training all of these areas for all of us is important, but I think it's, the importance is just emphasized for those individuals that have had these exposures or are having these exposures, certainly. And so I absolutely encourage individuals to be looking for strategies, whether they, are having clinical issues that need help with from a mental health standpoint or cognitive standpoint, or a motor control standpoint, to get in to see the experts. But then there's that, above clinical side of things where it's just, you want to be performing at your highest level. You want to have that mental fitness, and to do so, you have to train that. And I think it's really important to recognize that we want to look for all these different tools to add to our toolbox, so we always have them to rely on if we ever need them. And so this is just the way I approach a proactive kind of performance training of the motor control, because it can have a significant impact on quality of life, particularly later in life. I'm sure we all know, elderly grandparents or parents that have had, falls and things like that. All of that's going to be coming from activity, strength, and all of this stuff, the processing of sensory information. All right. So, then the next really level that I typically move on to when training this is movement with that divided focus. So I'm wanting to train quick and accurate eye movements, target to target, while maintaining speed and precision of footwork. And, like I had mentioned before, typically as I start to load visual demands, speed and precision of footwork typically decline. And obviously, training this in an extremely controlled environment, we're trying to optimize this, but it obviously has even more demand when you're in scenarios like in this picture where you're, chest deep in muddy waters. That's just going to load those sensory systems even more, particularly your somatosensory and vestibular systems while you move through that kind of an environment. And so ensuring that, we're proactively training this can be really impactful on the ability to execute and maintain performance under any condition. And then when I train this, I typically progress to adding in a head on a swivel. So we're adding that acceleration component now, which is going to load up that vestibular capabilities even further. And it's the same thing, looking at quick and accurate head movements, target to target, while maintaining speed and precision of your footwork movement. And then I typically progress to movement with eyes closed. And this one is, like all of them, all of these progressions are earned. You want to make sure that you're doing so safely, just like you earn adding more plates to the barbell. And, this is obviously going to really load up that vestibular and somatosensory system. And in preparation for those times that you're in these low or no vision environments. And ultimately, how I look at this is really just trying to identify consistent variables, because when we're preparing for unpredictable conditions, I think it's really important that we identify the variables that are consistent across scenarios, because there's always going to be things that are unforeseeables. So while in the gym, we optimize and we train foundational movement patterns like push, pull, hinge, squat, lunge, carry, we can also train foundational sensory capabilities like target following, divided focus, head on a swivel, and vision removed. And really the hope is that, with this kind of proactive, continuous training, we're reinforcing particularly the motor control regions of the brain and capabilities, so that throughout an individual's career and lifetime, they're able to have some control over performance, particularly when in any unpredictable environment they're needing to perform under. And, hopefully it helps reduce any kind of a feeling of that intangible slowing down. And like I said, I really, encourage individuals to not just proactively train motor control for both, readiness and lethality, but to recognize that we can address emotional and cognitive performance in a proactive and continuous way as well. And hopefully that also elevates performance capabilities, but that we're also, the hope is to have, an impact on long-term quality of life as well. So that was my presentation. I'm not sure how to get out of this, and if you can see me now.
Yep, we can see you. Folks, I know, again, I had a bunch of questions that I highlighted through there. Some of those were relevant to the conversation. Some of those were sidebar, but that's okay. But no, I think this is just so important. And I think, again, a lot of this stuff, even outside of someone that is suffering from different subconcussive events throughout their life, obviously decline is decline. And what's interesting, I think, is that so much of this can be confused with just aging, right? And I think that's going to be one of the challenges for veterans going forward is, I think the VA, as you look for treatments for this or even compensation for these types of things, ultimately it's going to be one of those easy things to kind of, well, you're just getting older. And those are the things that we accept too. One question I have for you, Dani, is what do you think is the best way to address the denial element, especially when it comes to guys on a team? And there was a comment up here by Jeff. It was one of the few bright things he's ever said. Let me pull this up here. Let's see. Basically, he was saying, when we have such small forces to begin with, there's going to be guys that the last thing you want to do is get pulled from a team. So, what are some things that we can do for people? Because, especially when you're deployed, it's like you don't know if you're sick, if you're just tired. You don't want to be the weak one on the team. The last thing you want to do is end up in a situation where you're getting pulled from the team. What do you think are some good strategies for people to kind of either, self-diagnose or just come to the realization that, there's something that is real here that's taking place that you need to address?
Yeah, I mean, if you're having symptoms like concussion symptoms, I mean, I think that you need to be going in and getting addressed. What I want to emphasize is that it's literally the speed at which you're processing information and able to accurately engage with any kind of a target is going to be impacted by this. And so that's obviously going to have an impact on both your life and the lives of your teammates, right? And so that's what I think is really important, is recognizing like your balance in the precision of how you're moving, how you're able to engage and follow targets is what's at risk here. And so, if you're having these symptoms, and that's what's hard too with concussions, is that it's often underreported because people don't want to be pulled out of the game. They don't want to be pulled off a team. But I think especially when we're talking about, people on the teams that, when we're talking about life and death, just understanding what it impacts. And I can't make that decision for you, but I think I can show you what I want to do is show you how that impacts your performance. And it's impacting the speed at which you're processing information, your ability to keep targets in focus, your ability to maintain control of your movement. And that's in a controlled environment from the research. So it only gets harder from there. So I mean, it's a tough if it's tough. I mean, I don't have a perfect answer for you, but I do.
No, and I get it, and I think that is definitely the approach that would at least get the best results, is make people realize, like, look, if you stay in the game, you're just going to be a liability to your team. And maybe, you talked about rest, you talked about these different ways to address these things, where I do think as war fighters, hopefully we start to, because, I mean, and again, there's many folks on this comment and this and watching this right now, and people that are watching the future. It's nothing to, hit 50 breaches, where you're blowing doors, where you're shooting rockets, and, you've been up for 3 days straight out there away from everything else. And I do think that some of those things that we end up putting ourselves through, even from a mission planning standpoint, I was definitely involved with some of the mission planning, and there's part of you saying, is the way this mission looks like, we're going to be pretty much up 4 days straight at performing at a serious high level. Does this make sense? And there are definitely times when I don't think it did, but we put all these weird things on us, and again, we're special operations. This is how we do it. This is what we're going to do. We have no limit to our capabilities, and we're just going to push, push, push. And we do that, and I think there's probably a lot of people that have been killed and injured because of that approach, unfortunately. And hopefully we get a little bit smarter. And again, I think it's people like you, and hopefully different discussions like this that make people stand back and say, hey, look, you know what we're doing is not only going to have a long-term effect on our mission capabilities and our quality of life, but it could have a very real and dire effect on our mission capabilities in the near future. And I think it's just important to get this message out. I really do.
Yeah, and I look at it, the one thing I really like about it in the sense of motor control is that it's not something that your mental toughness or you can just rub dirt on it or muscle your way through it. It's going to work or it's not. You're going to have that speed and accuracy or you're not. And so I think it's just, I think there can be some developments in the future which should be really led by the team guys to really say, okay, what's too much and what's not, in the sense of how much can you be exposed to and how is that affecting that speed and accuracy. And if you're seeing guys that are really off balance or showing that they're not able to keep up with what your level is of expectation, then speaking up with each other. And I don't like to say what you should and shouldn't do because I don't think that's my role. I just want to educate you and give you as much resource and knowledge in that sense to make those kinds of decisions.
No, and I think ultimately that's what it's about, is educating everybody, and mainly leaders and the leadership out there at the team level, at the battalion level, brigade level, strategic, tactically, everybody in between, where they can start making better decisions based on the holistic outcome of everybody. And I don't, and again, when you're sitting in a team room and you're planning a mission, it's easy to get short-sighted on just that mission and the things that the objectives that we want to um, address in that moment, as opposed to, here's what I say. There are definitely many folks out there that if they were armed with this information, they would have made better decisions, and definitely me included. I would have addressed things differently. I would have done things differently. At the time, I'd never heard of any research saying that, like, hey, eating door charges all day or whatever else, every time you're doing that, you are causing damage, not only on the immediate that you're going to experience in the immediate, but definitely, almost definitely going to have long-term issues down the road. So, I think it's, like I said, it's just a matter of making sure that we get that message out there and continue. I'm just glad to see that there's more research being done on this, and people are taking it much more seriously.
So what do you guys want more information about? I think really what I don't want to see is that, researchers just take this and run with it and do what they're interested in and not provide information that's of value to you all. So if you could have these studies done, what kind of questions would you want answered? What would you want the research to look at, and what would be of value to you?
I'll let everybody throw in their own comment on that. But one thing that I would like to see, when we talk about coming up with these basically performance-based therapy plans, right? That would be really cool. And you probably have some of these things, but like, hey, what is a workout that I could do, or what are these different physical therapy activities very specifically, laid out to where it's like, you need to do this, 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 and this on Monday, Tuesday, Wednesday, Thursday. And, I'm not saying to give us answers on that now, but what I would say is, those are some things that you could probably lay out, Danny, and maybe even put in a Substack. And I guarantee people would, support your research on that. And I think that would be really cool. And again, all of those things, when we're talking about just having better response times, there's a lot of things going on in our brain that affect those types of things. And I think, if I won't say it's a one tool fits all solution, but typically on those types of issues, if we can incorporate these things that really are meant to address, subconcussive problems, or, TBI, or whatever it is, those will also help people that, like me and many others out there, that want to perform at a high level continually, through all stages of our lives. And, maybe if you could develop some of those types of things, I think that'd be really cool. And, we would definitely help you promote it on here for sure.
Yeah, I mean, so what I showed today is really part of the progression of how I approach these things, and that's really loading up those capabilities. I like to incorporate them in a warm-up. I also incorporate some of this into how you can train, particularly the vestibular system, and adding it into kind of a plyometric training. So I do work on that some too. But certainly that's really what my focus has been on. I want to, my approach is really this kind of training of the sensory systems for situational awareness. They should be incorporated in strength and conditioning programming. And I think it can be easily incorporated into an individual's warm up, and then however much they want to take it from there, it's endless in that sense. And I do think that it's you guys that will define what is possible in this area, because no one depends on it more and has more skin in the game than you guys do. And very few people have the discipline to actually consistently put in the reps to train it. So I definitely think that it's an exciting area as well. And I think it's being talked about much more so, particularly in the strength and conditioning fields.
Yeah, this is a comment that's come up. Have we seen anything like homeopathic, whether it be cannabis or anything else? Are there any other treatments being explored that are non-pharmacological on that?
Yeah, I don't think I don't know about memory cognition and reaction times with regard to cannabis if that's going to be helpful. I know a lot of people that use it for sleep. That's certainly not my area of expertise. But and psychedelics are a big thing right now too. People looking into that and hopefully getting some funding for further research. I think it's really individualized. I'm not up to date on cannabis research by any means, but I do think that if it's something that's helpful for you and it's important for you, I think encouraging the research in the fields that you guys want to know more about is important, and speaking up about it. I think that the nonprofits that really, and there are a bunch of nonprofits that advocate for veterans, and being involved with them and communicating these values and interests to them so that they can advocate for you, because they're usually very well connected to leaders and decision makers. I think that's a really great strategy. And I really think that whatever is important for you all is what needs to be prioritized. Like I said, I don't want to see a bunch of money being pushed into the research, but that's prioritizing things that you're like, okay, that's great, but that's not going to be realistic or helpful. That's not how it works in reality, kind of a thing.
No, it makes perfect sense. And again, folks, if you have other comments or questions along those lines, what I definitely want to do is, and I'll work with Dan, our web guy, but what I want to do is definitely get a kind of a health and wellness resource page. And I definitely want to start discussing more on health and wellness, everything from diet, everything from exercise. It's one of the things that I'm very interested in, try to stay up on. And, mental health is a big issue too. I always want our company to be someone that veterans and even non-veterans, right, that can turn to us and say, hey, look, you know what, we're looking for answers, and we want to have some resource pages like this, and definitely stay in touch with Danny, have her on again in the future, and talk more about this, along with, I'm sure there's many other things we can talk about, just from a health and wellness standpoint, just from her physical therapy standpoint, and background. But yeah, if you have additional questions up there, throw them up there and I will send them on to her. And she can see those too for the most part. But I am having to toggle back and forth between mics just so that we don't have echo. All right, it looks like we're talking about a lot of different emerging treatments over here, everything from ketamine, which again, I've had lots of guys go down to Mexico and have had they've told me about just life altering experiences in a positive way from a mental health standpoint, with the psychedelics down in Mexico. I've actually had a couple guys try to, like, Gary, you got to try this. I'm like, that's not really something that I'm currently suffering from. But I get where they're coming from, because it is, people are definitely getting into these alternative methods. And let's be honest, I think a lot of times if we are not on medications, uh, I'm not seeing a lot of situations where people that are stuck on medications have a better outcome. So I think between, just some good health wellness when it comes to exercise, when it comes to surrounding yourself by good people, trying to stay away from, there's a lot of folks out there that just don't need to freaking, be on alcohol or whatever else, right? There's a lot of different ways that we can self-medicate that we may get some short-term effects, but I think for the long term, for our health and wellness, it doesn't end up being all that positive. Well, what else you got for us, Danny?
Um, yeah, I think that's it for today for my presentation wise, but I'm always here for you guys. I hope you reach out and ask questions. I'm sorry, I'm definitely not an expert in all of this. There are a lot of different professionals and experts that have different insights than I do, but hopefully I can point you in the right direction. So yeah, if you have any other questions for me, please reach out.
Yeah, definitely. I believe in the comments I have her contact information. Again, she sent me a link. I put the link to her website down there. And like I said, we're definitely going to get a resource page on our website that will have that information. We'll have her on again for sure and talk more about this. Number one, I just want to thank you, Dani. Thank you for coming on, spending time with us and helping educate everybody on this. I want to stay up on this, see where this goes, and just keep, even if we did the same thing over and over, I just think it's really important that people hear what's going on with this. And it's just something that people aren't aware of. And I really do think everything from Junior Seau and some of the other people that we've seen in the media that clearly have suffered from not only concussions, but probably from subconcussion injuries as well. I think it's just important, and we need to make sure that we have the greatest fighting force on the face of the planet, and that means addressing these issues. And we got a lot of work in some other areas too, because I don't think we're there yet. But anyways, folks, we're going to go ahead and call tonight. And again, thank you, Dani, for coming on. Stay tuned. Dani, just stand by, and we'll talk a little bit after this. But folks, we appreciate you. If you want to, make sure you like, subscribe. Again, this video will kind of go down. It'll go away. Then it'll get reposted. And then, people are like, where'd all the comments go? Well, they get erased, right? It's just the way that YouTube works. So go back there, throw up some comments, throw some likes, all those good things. If you'd like to, definitely support us on Patreon. That helps us out. And for all you guys that are in the comments right now that support us on Patreon, we really do appreciate that. That goes a long way for allowing us to do what we do, buying the equipment, paying Dani's fees. Come on, I'm just joking. She didn't charge us a fee. She's on her free. But anyways, we really do appreciate it, and we will call it a night from there. But until next time, stay armed, stay ready, and we'll talk to you soon.